What's it like to get a $20 million donation call out of the blue? And what do you do with that work to impact Philadelphians and people around the country? Today on Generosity Conversations. Hey, I am Chris Wink. I am the CEO of the company that publishes generosity.org. And technically, we're news organizations that cover the work that professionals do. Today, I'm joined by Trooper Sanders. He is the CEO of Benefits Data Trust. Hey there, Trooper.
Hello, how are you?
Pleasure to have you. So we were going to have a conversation around the great work and growing work that Benefits Data Trust, which we're going to do. But then you got an unexpected bit of news in the last week, an historic and seismic $20 million donation from MacKenzie Scott, the notable philanthropist, former wife of Jeff Bezos, who's doing some incredible work to upend and change philanthropy. So we're going to talk a little bit about that, given how timely and large it is. But I want to thank you for being here and having the conversation generally. Trooper, can you start with how did you get the news of this $20 million MacKenzie Scott investment donation?
Well, it's a bit like forgetting or not knowing that a second Christmas morning was added this year. I received an email out of the blue from an unrecognized email address. And luckily I opened it because, we have to be careful about opening
really
days, and arranged a brief conversation. And within the span of, I think the call may have been 7 minutes, was told that MacKenzie Scott was making a very generous investment in Benefits Data Trust, which is just a dream for a nonprofit CEO.
I don't want to at all get lost in the details here, but we've also done some fair reporting on the inevitable and unfortunate spamming that takes place because of this incredibly unusual process. So I just wonder, as a small aside to other nonprofit pros, or do you have any advice about how did you decide this was a legitimate enormous moment as opposed to someone is playing me?
Right.
How did that look like?
Well, it's interesting. I think the way that the email was framed, which is probably not helpful in terms of people combating spam, but there was just enough context and credibility around it that again, and there were no links in there to click, so there was no app to click on anything. But the relatively lower risk of responding to the email saying that yes, I did have time to have a brief conversation was what did it. So don't click on links.
Look at that. We you came for a conversation around benefits data investment, and you're getting some cybersecurity advice as well. Trooper, you're classic. All right, let's move then into a bit more of the work that'll happen with this donation and the work that you guys do as a whole, because your work is national in profile. Why don't you start and just give us a little bit of level setting? It's been a remarkable last couple of years for federal benefits and federal stimulus, so your work is really relevant. A BDT spokeswoman rightly points out $450 million in federal and state benefits are left on the table each year. This is the work that you do. Maybe update us on how has the Benefits Data Trust work changed in the last couple years, setting us up to where you are this week.
Sure. So first, it's nearly $500 million only in metropolitan Philadelphia that's left on the table.
Right.
Nationwide, before the COVID-19 pandemic, we estimate that it is about $60 billion of assistance to help people pay for groceries, access healthcare, go to school, to be able to join the workforce and enter the middle class was left on the table. And the real challenge is, over the generations, we have made the democratic decision in America to create programs through government to help people with meeting those critical needs. And also, I might add, by meeting their critical needs, it invests in making our country stronger and all of us stronger and better off. We've built these programs and made the political decision. But as anyone knows, when you create a complicated program, a lot of complexity comes into play. And I'll say that there are some troubling racial and other aspects to making it, in some cases, intentionally difficult for people to navigate these programs. And so BDT has been here since 2005, starting in Philadelphia, our hometown, to help be a bridge and help people not only tap those benefits, but then we also work with government and other partners to bring about structural improvements to programs that many multiples of people than we can serve can benefit from.
Do you have any rough senses? I'm sure someone on your team does, but do you, how big an impact on poverty in a place like Philadelphia or nationwide would we have if we simply claimed the federal and state benefits that are already earmarked and already, as you said, democratically approved? How big of an impact on poverty does that have?
It could make a meaningful impact. Of course, to have a structural impact on poverty, and in particular intergenerational poverty, there are a number of broader structural issues we need to address. But if we think about the hard work in Philadelphia, and there's a wonderful coalition right now that is really working to tackle poverty. If we think about the hard work and struggle that we face adding $1 million here to a program or a few $1,000,000 there to a program, or my brother and sister nonprofit organizations across Philadelphia who know how they have to stretch pennies to help families. If you think about that, and then think about we have almost $500 million sitting on the table. Now, I think with any of us, if we can think of any other challenges, if someone said, "What could you do with a $500 million?" I think we could show them a good time.
Well said, indeed. I'll actually know. I see one of our listeners out of Pittsburgh notes, as you're alluding to, people around the country are in a very similar situation here. These are existing tools impact poverty. Just kind of a quick question I see here we got was, in any given city, what is your standard advice if someone wanted to have impact in folks collecting benefits? I know Benefits Data Trust itself is a resource. I know there are community groups around the country doing this kind of work. What's your quick advice when folks say, how do I make sure my own hometown community are engaged in the benefits they can get?
Sure. So if we kind of look at a stack of what people can do, one of the simplest but most powerful things that we can all do collectively, no matter where we sit in a community, is tackle the stigma and shame that surrounds asking for help, tapping public benefits. We have a wonderful culture in America that is about the individual and progress and making your own way, but there's an ugly side to that, where asking for help and potentially relying on the public purse at times when you're facing tough challenges, we put so much shame and stigma around it. And let me just make this more concrete for folks who might be in more fortunate circumstances. Think about how many people who take the home mortgage deduction when they buy a home. And then think about how many barbecue conversations or water cooler conversations do we have, yucking it up with our friends about the great money we get back in our tax return from the home mortgage deduction. There's no shame around it. In fact, we take pride in that. Well, guess what? The home mortgage deduction is effectively welfare for better off people who can buy a home. Most of us would already buy a home, whether there was the tax deduction or not. So we're getting something from the public treasury. Now, why is it that a young person or a student who is trying to go to college and enter the middle class, and they can use a Pell Grant to help pay for school? How many people brag about being a Pell Grant scholar? How many people who need to buy a better bag of groceries to make ends meet, and to, by the way, make sure that their child can have the food they need to learn and grow and enter college and enter the middle class? We don't have a culture that says, you know what, I just needed a bit of help, but wow, boy, I ate well, and we're doing some great things for it. So one, let's change the culture around this.
True, but what does that actually, I want to hear your second, but just to jump on that, because I want to get to Nikhil's even embedded point, but what does that look like in practice to destigmatize that? Is that at the supermarket line? Is that, like, what do you think that really means?
Sure. I think there are a few things. I think one, frankly, it's in our everyday conversations. So I think it is in our communities when we talk about these things. I think it's pushing back in the conversations where it's easy to talk about people being freeloaders and all of that. But then it's also thinking about in the workplace. And let's be honest, there are many people who have jobs and are in the workplace who struggle or who may be facing uncertain times. And so it's saying, like, look, there's help out there. then I think it's having a conversation in our political conversations and making sure that we understand, you know what, in the city of Philadelphia or in Mercer County, we are about helping people when they need it, because we know they're going to get on their feet and they're going to give back. And we're just not going to put up with putting unnecessary shame and stigma and embarrassment on our neighbors.
I need to push this through, but I want to make sure I try to drag a bit more out of Nikhil's question there, who left in the comments. Folks that, what would you recommend to civic stakeholders around the country? What should they be asking if they're nonprofits or eco districts, or like what's a question they can ask to say, like, folks are doing the work, via
Sure.
benefits data trust or others?
Yeah. So here's one real important practical solution that we find, and it's data matching. So, for example, we know and we work with governments all across the country to, for example, take the list of people who are receiving Medicaid and then comparing that to the list of people who are receiving SNAP, or what used to be called food stamps, and comparing the two. Because if you're on Medicaid and are getting your health care, chances are you're eligible for SNAP. But there are a lot of people who are on one but not the other. And so by matching those lists, you can target. And it doesn't just have to be that. A school system could look at who's receiving free and reduced lunch, or who may be on some of their more day-to-day programs, helping families who have lower incomes and facing challenging times. And it might be building into your day-to-day outreach to people, into your text messages or letters when you're talking about the book drive or the backpack drive for the summer, of saying, hey, have you applied for SNAP? If not, can we help you out with that? Or here's a link to go to. So people don't have to be benefits data trusts to help people, to sort of just nudge people to think about the other benefits that can help them, and how to get on the path to making sure they tap them.
I like that. And Nikhil, I'm going to send a BDP person to follow up with you, because I appreciate your additional comments. Thank you for Nikhil. Tight on time though, Nikhil, so I'm going to push forward. Trooper, let's use MacKenzie Scott's remarkably sized investment that came out of the blue as a starting point. What does a $20 million investment out of the blue do for benefits data trust in your work? What will you be doing with it?
Sure. Well, first, it builds upon the extraordinary support that BDT has enjoyed since we founded, from our donors, from our customers, from the communities where we work, who really built us up and drove us forward, and got BDT to a place where we would be an attractive prospect to a philanthropist such as MacKenzie Scott. But what this really does is it allows us to not only continue our work, but also to look farther ahead. And really how we are framing this is that her generous gift is allowing us to put a down payment on work that we are going to do over the next decade to make the benefits access challenge a thing of the past. So today we estimate it's at least $60 billion left on the table, or nearly $500 million. Or nearly $500 million available in Philadelphia. We're going to be doing work over the next decade to make that go away.
And lasting impact of that, do you guys put numbers to that? Like, how many people does that represent out of poverty? Do you have any handle on that?
So broadly speaking, when we think nationally about the $60 billion, it gets into the 8 figures of the millions of families across the country who are eligible for benefits but not receiving them. And so it is both a meaningful big number, but it's also a solvable challenge. Like, surely in a country with more than 300 million people, we can make sure that 10 to 15 million people and related households can get the help that they need to get ahead and make ends meet.
Just because Philadelphia is your home, the BTT's hometown, again, we have folks from around the country listening in, but to use Philadelphia as an example, it's routinely referenced as one of the poorest, as the poorest big city. I wonder if in your own work with Philadelphia as one test bed, again, I understand BDT does work around the country. Why is Philadelphia so poor as big cities go? Do you have your own sense of that?
Yeah, and it's really an extraordinary challenge. And over the next few years, BDT is working to double our reach and impact in Philadelphia. The reasons why the challenge exists in Philadelphia are both many and few. I think we have to look at the structural changes and evolution of the economy over the generations, the legacy of not only Jim Crow, but frankly in the North, Jim Crow's first cousin that
Mm.
existed for generations that has embedded racial inequities. I think we have to look at all of those broader things that has really created this system of structural poverty in Philadelphia. But now the other side of that is we have to look at, well, what are the solutions at scale that's actionable and where we can bring people together across the city and across the different communities and networks. And I firmly believe that tackling this benefits access challenge in Philadelphia and putting that nearly $500 million to work is both actionable, it's uniting, and it's something that we can do in a realistic time frame to actually show, let's get something done. Because sometimes when we talk about things like structural poverty and structural racism and other things, it can just seem too big and overwhelming, and it wears people down. So it's like, well, that's something that someone else is going to have to solve. But I can't even wrap my head around it. We can wrap our heads around helping students get Pell Grants to go to school, or helping moms get health care so that they are healthy and their kids are healthy. So it's about being bold and actionable.
A longtime generosity contributor, Devoni DeVore, shout out, would often write that every nonprofit's a policy failure, which is a hot take of his. You can take it or leave it. But one of the ways to understand benefits data trust is a version of that your core work right now is saying there's just a sheer gap. We've already committed this dollars, but we're just not using it. Let's at least start there.
That,
Which,
that, that's,
yeah.
that's exactly correct. That's exactly correct. But to address a policy failure, you can't just be theoretical and academic about it. And the magic of BDT's work is that we are both focusing on helping as many people today. And so in Philadelphia, helping as many Philadelphians as possible today access benefits, but then also addressing the structural issues around modernizing the benefit system generally and working closely with government and others so that over time we can make this issue a thing of the past, and everyone who is eligible for benefits and wants them can get them through the normal course of business. Frankly, the way that people who are more privileged and fortunate are just through the normal course of business. We can get groceries delivered or go to the grocery store. You or I could sit on our screens right now and begin the process to apply for $1 million mortgage with far more ease and dignity than someone who's trying to apply to get a couple $100 to feed their family.
Mm-hmm. You've hit on a couple times the idea of structural poverty, intergenerational poverty, and I appreciate that line you're drawing. That there's clear and actionable work that Benefits Data Trust can do and does do right now, but there are these other issues that loom large for you. Something that comes up a lot in our reporting on both the generosity and the technically side of things that is close to my own interest is declining upward mobility through generations. This is a century-long story. There's an outstanding question of whether Gen Z will follow millennials and be even worse off, even be even less likely to do better than their parents, or if millennials were a low point. That's an outstanding question. I'm curious, from where you sit, are you optimistic about economic opportunity in the future in this country, in the cities you serve? Are you optimistic about our ability to reverse these continuing and dogged century-long trends of declining upward mobility?
So I'm both optimistic and realistic. I was born in Detroit, that helped usher in the America's 20th century economic miracle, and has gone through the ups and downs just like Philadelphia. And so I am optimistic about innovation, about the ability for an economy to renew itself, about finding new opportunities and new sectors and new industries that can put us to work and help us grow. But let's be honest, it's a painful process when it's about the individual and households. You know, we like to say that, oh, no one wishes that the buggy whip manufacturer was still around because Henry Ford brought in the Model T. Well, that's true, but it's different if you've spent your career as the buggy whip manufacturer and trying to put your kids through college. We also need to recognize, how do we help people make that transition? But what you are talking about also speaks to this benefits access challenge is not just about poor people and poverty. This is about the middle class. This is about the best interest of the middle class, and frankly, almost anyone who isn't independently wealthy. Because if we're honest, most of us can, get quiet and think about our own career trajectories and the changes that might affect us. One day, natural language processing might enable an AI to be an interviewer and discuss something like this.
So, I'm toast, Trooper. I'm aware of that, to be clear.
So, we all, if we're really honest, we might not be on the precipice or worried week to week and day to day, but most of us are one or two unfortunate turns away from being in a spell of challenge and desperation, where we might need public benefits to help us go to the doctor and buy groceries, or we might need it, if you're doing well in business, but you have a rough patch like during the pandemic, and you have to cash out your retirement plan and your savings accounts to keep the business going, and you can no longer help your child go to school, well, they might need that federal Pell Grant. So I think when we think about this $60 billion challenge and solving this over the next decade, if we're just blunt about it, this isn't charity for, quote, those people. This is about the self-interest of all of us who either might need help, or who, frankly, our jobs and economic growth are on the line of as many people as possible being economically secure, so that we can keep the economy going, so that we can have the workforce of the future. So this is about all of us.
Trooper, I'm going to leave it there as we're at time. Trooper Sanders, CEO of Benefits Data Trust. Trooper, thanks so much for being here.
Thank you.
All right, everyone. We'll see you next week.